After 35 years, we do have some milestones to celebrate. Way back in 1977, when Hospice of Northern Virginia was just getting started by a group of friends and neighbors and volunteers, Dr. Josefina Magno became the first medical director in the country and the first medical director at Hospice of Northern Virginia. She provided such education across the country to start hospices. Even then, we were concerned about how we would teach this concept across America. Hospices were beginning to start, mostly run by volunteers. In the 80s, Congress came to Hospice in Northern Virginia and said, we'd like to try something. If you could actually pay your nurses, could actually hire some physicians, could hire some social workers. After they tried it, Congress said, you know what, this really works. People are happy with it. They're getting good quality. President Ronald Reagan signed in the Medicare Hospice Benefit. And it started all here at Capital Caring. When something happens in our community, like 9/11, when the attack came to the Pentagon, help was needed, not just from the first responders, but people who would be able to comfort people who were experiencing this great loss. Our bereavement counselors, who are trained and seasoned, were there to hold the hands of the families, and I could not be more proud. It's part of being part of a community. I bet I wasn't on the job 3 days till I got the first call from Jack Fox at the time, head of the Daffodil Ball Committee, who was telling me that indeed that they wanted to hear my vision for starting the first inpatient center in Northern Virginia in Loudoun County, and that they had already started raising money, and today are almost reaching a $2 million mark in gifts to the Adler Center for Caring at the Van Metre campus. Since 2006, we've been focused on matching our world-class quality program with world-class sustainability, and that means great finances. You drive with quality and you will achieve success. We came up with key metrics. So if you go to any one of our neighborhoods on any given day and ask people, how are we doing with pain control? They will be able to respond to you neighborhood by neighborhood how we are doing. But we really want to be the leader here, which is what the expectation for your hospice in the nation's capital really is. We had set a goal for ourselves at Capital Caring to meet the 1,000 patient mark and get the word about this best kept secret in healthcare called hospice. And in 2010, we achieved that. We reached 1,001 patients being served daily here at Capital Caring.
Things have changed tremendously over the last 35 years. People are living longer, but are also living with oftentimes multiple chronic conditions. So what started out as a luxury for a very small number of people has now become clearly recognized a necessity for all people facing the end of their lives.
You have helped us come this far. Because of you, we have been able to bring the highest quality hospice program directly into the community, serving families and friends as well as patients, never turning anyone away. We want you to join us on this successful journey and be ambassadors for hospice for the next 35 years. Thank you.